Assalamu alaikum. Good evening, everyone. We'll welcome you to our special webinar tonight, which is very handy, especially when it is talking about local anesthesia and doing lots of cases during this lockdown time under local anesthesia. Before we start, we like to extend our most sincere condolences for the biggest loss that we had in Plastic Surgery Society, Dr. Mark Gardner and Professor Hassan Badran. On the behalf of the Saudi Care Society, we extend our condolences to their family and may their souls.
What I'd like to share is local anesthesia and plastic surgery and how we can decrease the need for sedation. There is a wide awake hand surgery book, but I'm not making any money on it. All of the money goes to less garbage and less unnecessary cost in hand surgery. It's the lean and green effort of the Hand Association. And there's also a Wallant website, which is free to all hand surgeons and hand therapists. If you're interested in wide awake surgery or any of the things that I'm saying today, those are two very good sources of information. I think that it's really important to understand that local anesthesia only reinsert needles in numb skin.
And so I'm going to put my first 10 cc's in there without moving anything at all. And then I'm going to put in the next 10 cc's by starting at least 1 centimeter inside the white-pink junction. So this is 1 centimeter inside the white-pink junction, so I don't think he's going to feel anything there. Did you feel that? No. That's good.
So that's the key. Every time you reinsert, you go 1 centimeter back from where you know the epinephrine is working. If the skin is white, the epinephrine is working. If the epinephrine is working, the lidocaine is working. And you always go from the radial side to the ulnar side, to the radial side, to the ulnar side. Same thing when you're doing a cleft lip. You go from the lip to the nose, to the lip to the nose, and they
to be describing this technique and giving a brief overview on other techniques that are available. As we all know, there's been a great evolution in anesthesia setting for carpal tunnel release and hand surgeries. In the past, all these procedures were done under general anesthesia. As we became braver, we started doing them under blocks, whether IV or brachioplexus blocks. Following that, we moved to local anesthesia and local nerve blocks. And recently, over the past years, most of the hand surgeons are adapting the Wallant technique with the epinephrine and no tourniquet. This has happened for multiple reasons, because we want to make our procedures safer for our patients, minimizing the complications and side effects of different medications, whether general anesthesia or blocks. We want the patients to have a better experience, in some way, modification or a different version of the hole-in-one technique. So in this technique, we start the first injection of local anesthesia in the distal palm, around 1 centimeter proximal to the proximal wrist crease, and you inject subcutaneously in a perpendicular fashion 1 to 1.5 cc's of local anesthesia, whichever kind you want, and watch the skin as it forms a bleb or a wheal without advancing the needle. So this minimizes the pain for the patient. And the key is to wait around 10 seconds to allow this area to start to become numb and the local anesthesia to work. Following that, you proceed to your second injection, and this is done at the edge of the wheal or the bleb from the first injection. And if you wait